chin up.
Mm.
Okay, all right.
Wow.
It's like something from Star Wars. Bring balance to the force. Bring balance to the spine. See how it's pouring out of that spot, right? That's the epicenter. He's off to the races.
I can't wait.
What's it? Left?
Oh, yeah.
Oh, man,
That was
right
awesome.
side.
That was amazing. Yeah, so basically it is killing me. It feels like there's a knife stuck like through me, basically. So I mean, like I do feel it in the front, but it is mostly like basically where my fingers can barely reach is where I feel it. Yeah, like right there. Yeah.
Not
Yeah.
lateral, like I said earlier. Not so much out here.
It can be. I can feel pain over there too, but it is 100% like 24/7. I do feel pain there. You know, basically I was on this incline bench press sort of thing, so I was really only sitting back about like 15 degrees.
Yeah.
But I was like pushing weights away from me at an angle, and I heard this, and it was like immediately painful. And like I had to stop like right there, and I was like, man, you know, maybe I should go to the hospital or something. Like I didn't know what happened, but like you know,
How long ago was that event?
it was about 8 years ago.
Okay. So the difficulty is, you know, and so you've been going through some chiropractic care. They've worked a lot on that area, a little bit better, but overall not getting where you need to be.
If I'm lucky if I can get that. It feels like my rib head is out of place. If I can get it back in place for like a couple hours, like once a month, that's a good day. You know, just for that one day. But the rest of the time, 99% of the time, it is not in place.
And you've been through a lot of care on that area. They've taken images of that area. Nothing they can see on imaging.
Nobody sees anything.
Nothing's
like,
on there.
You know.
But nobody. And I asked you earlier, and I know you said they haven't. Nobody's taken any pictures of your neck. No MRIs of your neck that you can recall.
I mean, I think we might have done a few full body MRIs, but like you know, nobody like pointed out
Focused on your
anything.
neck at all.
Yeah, nobody pointed out anything in particular that was out of the ordinary. So
There's a thing we call referral pain. So in the 50s, they took salt, and I described it to you earlier. They took some salt and they injected it at every nerve root, and they basically, you know, chiropractic started in 1895, but we didn't have the wiring diagram until the 1950s. Knowing that when you inject a nerve irritant in the lower back, patients experience pain in their foot. And if you injected salt in the upper cervical, you didn't really feel it where they injected it. They felt it here on their head. And if they inject T10, you'd feel it along the rib. Does that make sense?
Okay.
And if you inject the lower neck, they would feel it exactly where you're describing, right in between the shoulder blade. We call this referral pain, and Carlin, you can kind of briefly look at that poster over there where the lower neck joints refer pain to that whole area, but very commonly, specifically, it'll be described very similar to how you're describing it, which is right there.
Yeah.
And so if it is a rib, and at the same time when you were doing this activity, there's a lot of stress on your neck.
That's a good point.
Right,
Yeah.
a lot of stress is going on your neck at that point. And so what I'm going to do today, I want to try to see if I can take some stress off your lower neck, see how your body responds, loosen up the upper neck, loosen up their back. And if it is a rib, I'm going to clean it out. I'm going to dig it in there. We'll gouache out. If it's something that's actually there. But because of the amount of care you've had on that area, and the neck hasn't been addressed as much. I feel that I think we need to work on that neck. And has anybody mentioned curve in your neck at all? Has anybody mentioned?
Yeah, I mean, a few people have a few times. Yeah.
Have they given a plan for how to bring the curve back and not so much?
Yeah, I mean, they've recommended the different like products that you can use to
stretching.
Yeah.
Okay. You have some sinus issues also a little bit. Is that just today or?
No, I mean, like I've had this problem with my right nostril, and I've got to tell you too. I had a doctor put some shots in that area.
Is it more on the right side?
It's absolutely on the right side, 100%. Yeah.
You understand that's not coincidental that you have symptoms on the right shoulder blade.
Yeah.
And that the whole right side of your neck can be inflamed.
Yeah.
The drain lines, for instance, of the sinuses all drain down the neck.
Okay.
And so what essentially nasal drip and overflowing maxillary sinuses are, it's not draining internally the way it's supposed to, and so it's overflowing out the top. And so forward head posture plays into this. The more forward the head goes, the tighter the muscles get in the neck, and that crimps the drain lines that then cause sinus issues and infections and ear issues, all these things.
Yeah, what about like tinnitus? Because like I had a doctor put some shots in my back, and after the second shot, it was like a series of 3 shots. After that second shot, I had tinnitus ever since then, and it's primarily in my right ear.
Yeah.
It'll occasionally travel over, but like same thing with sciatica. I have sciatica primarily in my right side. It'll occasionally travel over, but it's 99% of the time it's usually on my right side.
I usually find that there's compensatory problems. So one side is stiff, another side's abused. So you're gonna have one, and you might even see me working on the left side a lot today. And you might be going, Doc, it's over here. Why?
Oh, I understand. Yeah.
Because generally you have an area that's underworking and an area that's overworking, and we hurt in the areas that are overworking. So we want to find where is the part of the spine that's not doing what it's supposed to be doing to take the stress off the areas that are abused. The right lower back is mainly controlled by your middle back. They're connected to the neck.
Sure.
In the sense that the more forward your head goes, the tighter your middle back becomes. So the tighter your middle back becomes, the more we overstress our lower back. That lumbar curve that's supposed to be there, when that curve goes straight, all the weight like a ladder goes right to the lower back. And like I said, with that SALT study, if they inject the lower back, they get pain in the foot. All right, so we're dealing, your shoulders, middle of the shoulder here, ear hole, those should line up from the side. And the more forward your head goes, the more mechanical stress is put on the discs. The discs are a tough structure to understand because they don't have feeling. I can't ask you on a scale of 1 to 10, tell me how your lower cervical discs feel. They don't have sensation. What we can feel is the joints and those nerves that exit the side of the spine. So when the joints are inflamed or that disc hits the nerve, you're going to get symptoms in locations other than where the disc and joint primarily are. All right, so we got some shoulder tilting. Your body is in what we call compensation.
Sure.
The compensations aren't the problem. They're the result of a problem. Everybody will look at the compensations and try to change them. It's like, well, no, if your body's tilted, it's because you're getting away from something. How do you stop tilting? You get rid of the reason for why the tilting's occurring, right? I don't blame you for tilting. If I break my right ankle, I'm gonna tilt. Yeah. Feet together if you can. Feet together. There you go. Take a deep breath in for me. Listen up. I want you to let all the air out. Keep going. Yeah, real tight there. I got you, bud. Let it go. Let it go. I got you, bud. There we go. Deep breath in. I got you. 2 more. Let it go. Yeah, totally frozen. Okay. I'm learning you. Exhale. Chin down a little bit. Yeah, totally frozen. Okay. All right. Yeah, we got work to do. The mobility of your upper back plays into abuse of your lower neck. Do you see how if the upper back is tight and your upper neck is tight, do you see how the lower neck is left doing all the work? So, that is going to cause inflammation buildup in your upper back. And I'm going to clean out, like I said earlier, your upper back also, but it shows me that your lower neck's in a lot of distress.
Yeah.
And we gotta see if we can fix that. All right, I got your head. There we go. Let the side go right here. Let it go. There you go. Okay. You want to have this upper neck. Let it go. Chin up. Okay. All right.
Wow.
60% of the work of your neck is designed to happen right where I just adjusted you. It's not an even distribution of work in terms of the cervical area. Most of the other spine has an even distribution of work, but the cervical spine, the top 2 vertebrae, do 60% of the work, and then the 5 rest of the vertebrae do 40%. Does that make sense? Mm-hmm. So if you don't have the upper cervical working, then the lower neck is going to be under a lot of extra stress and doing work that it wasn't meant to mechanically handle. And then when you overstress the lower neck, you're going to feel it elsewhere. And so let's see if we can move some stress back up to the upper neck. We find that there are 24 vertebrae, 23 discs. 5 discs have all surgery. The lower neck and the lower back, 99% of the time, that's where all disc injury happens. And so I want to be careful to not further stress out those areas that we already know disproportionately have a large percentage of disc injury, right? And the idea of the word adjustment is to focus, movement into the areas that are stiff, to adjust them, to bring them back online, and to not adjust and loosen the parts that are already injured and loose. right? That way that we actually bring the spine into balance. It's like something from Star Wars. Bring balance to the force. Bring balance to the spine. Yeah, I got a clog all up here in the upper neck here. This is... You feel there's all these little lymph nodes in your
I'm absolutely feeling that. I
Mhm.
was just thinking about that.
These are all, this is the drainage of your sinuses, your ear, tinnitus, all of that.
Really? It's amazing.
You know, that all has to be. The mobility of the tissue is what washes the tissue, right? So when an area gets stiff and tight, it prevents it from mechanically draining. The lymphatics are your sewer pipes. They drain the sinuses. It's not supposed to have to come up, overflowing out the top. Okay. The curve in your neck maintains the suppleness. When we lose the curve, when your head goes forward, that's what introduces us, all these problems into our spine. And we don't live in a world of very many orthodontists, very many postural guys. And, and if your spine's not supple, even the stretches won't work. So we have to, like clay, you can't reshape hard clay. So if you put hard clay into a mold, it won't do anything. You have to first kind of make it all soft and flexible so that it can be reshaped. Right. When I looked at your back earlier, the left side of your back is more elevated. This the highest subluxated or highest misaligned spot is right here. Feel that knot right there? It doesn't exist on your right side. This is the culprit for the right leg sciatica. This is an injury, kind of a tear that then healed with a ball of yarn right here. And if we don't clear this, the right side abuse will not stop. This has to be. And I can only imagine nobody's found this, right? Is that correct?
Right,
Okay.
yeah.
Nobody sat here and dug and showed you that there's a blockage on your left side. The right side is the compensation. It's just the abuse as a result of this. You almost can name this thing. I mean, it's... Feel that, right? That knot should not be there. The original tissue was organized like railroad tracks. They slid together very easily, and then it got injured and it tore and healed like headphone cables into a knot. And now you have to sit here and brush it, comb it until the comb can go through the tissue effortlessly. It shouldn't get snagged. Yeah, a nice knot even on the left side up here. It's just... Come on.
I'm checking it for you.
Okay, all right. This is the whole. All of this is the cause of the right leg sciatica. All you do not. There is not much function right here. Gee, look at that knot. Jeez, that is. The idea with some of these orthotics is to emulate my elbow. They'll actually be used to copy this as much as possible, and you can actually use the Denerol to put pressure here to give you some semblance of, ability to care for yourself at home and not have to constantly have somebody like me or somebody to push in here, and that we can teach you to do it home care in that sense. And this is where we're going to be targeting. We got to target that. Need a little gristle right there. Need a little.
That's right, where you're at right now.
Mm-hmm.
That's where I feel it. It's hurt about.
Mm-hmm.
he was saying your back is just totally swollen, frozen.
Yeah. Gotta unlock it first.
Is that consistent with what other chiros have found? Just real stiff, or they tell you, or you remember?
Yeah, you know, but they don't put the elbow grease into it like this guy does.
It's like a bolt that's not turning. You know, if it doesn't turn, you don't just give up. You put some penetrating oil on the threads and see if you can, you know, soak the threads, and then give it another shot with a bigger breaker bar. And somebody's got to get these bolts turning. They're just joints. They're designed to move, and they're frozen, and well, it's going to cause problems. Oh, here it comes. Yeah, here it comes pouring out of here. Jeez, look at it. There's the knot I was talking about. See how it's pouring out of that spot right. That's the epicenter. Yeah, I've gua sha'd you evenly pretty much everywhere. You understand? And when you look at the video and later, you'll see that not a little bit came out around it, but where internally there's the most blockage is where the mark will be the darkest.
Gotcha.
And the care eventually leads to a place where no mark comes out anywhere. The skin just becomes kind of flushed looking, and you don't ever get this like dark reddening. That's the Shaw, they termed it. That's what's internally the blockages, the inflammation. And like I expected, the abused side actually gets plenty of blood flow. You understand? Or more blood flow than the stiff side. You understand?
Yeah.
Because it's abused. It's getting, you know, blood. The side that's stiff and stuck and tight, and that's the side that doesn't get much circulation. So the most Shaw mark comes out not where it's abused, it comes out where it's stuck. Right? Now I'm trying on the right here. I mean, there's some, but there's not nearly as much as what came out on the left. Right here is where the darkest. I just love the term Shaw because they call it like, which means like ghost, like a bad energy. You know, it's lactic acid. It's just injury, inflammation, whatever you want, cytokines, interleukins, whatever you want to call it. But it's chemical intermediates that then irritate nerves and get trapped in the tissue due to injury and posture. And yes. Nice. So there's a thoracic den roll I'm going to show you in a second. The idea of the den roll is to emulate what I'm doing right here, to get not only inward pressure, but also downward pressure to fold these vertebrae closed, you know, and reduce the hump, reduce the kyphosis that happens when our head goes forward. This starts to elevate the roots of the neck, attaching the shoulder blades here, stiffen the back. Lift your head forward. Put your forehead right there on your forearms. Forehead on your forearms. Perfect. You got it. Okay. And there you go. Just relax your back. Relax your chest. I got you, bub. We're going to lift up a little bit. Here we go. Breathe. All right. Breathe. Relax. Relax your back. Exhale. Come on, bud. There we go. Breathe for me, bud. Exhale. Breathe for me. Exhale. Wow, yeah, wow. All right, good. Arms down for me. Breathe. Okay, good, okay. You have to go on your back for me.
Okay.
There we go, nice. No, okay. Just checking. Good, okay. I would work this spot right here. The tighter this gets, the more stress the knee gets in like a torque fashion. This is what causes foot flare. You know, your toes will point outwards. The tighter this gets, the more stress goes on the medial meniscus. You want to stretch the quad. The goal being that you get your foot up on the table. Does that make sense? Get the idea? You want to work on this guy with the toes pointed. Does that make sense? You're perfect, just like that. Get the idea?
Yeah.
You know, you want to master until your knee can touch the ground. You understand? That's what you want to work on, is mastering that to the point where it's just a joke.
Yeah.
I believe that the more you stretch this out, now, see how this tightness here is what I'm trying to work on by doing the quad stretch that you're doing.
Okay.
You want to do that with the goal of getting rid of this knot
Yikes. Yeah.
on the inside of your thigh here. Right there. There's a lot less knot over here.
Yeah. Because I mean, I don't accelerate with that foot, you know.
All right. Take a deep breath in. Exhale. I got you. Not gonna fall. Nobody falls. Nobody falls. I got you. Breathe. Let it go. Okay. Other side for me, other side. That's good. Maybe sit for me, facing my wife. Press back. There we go. Okay, okay. Check and see this guy. There we go, yeah.
Yeah.
Okay. Go ahead and tilt your head to the right for me. Tilt right.
Oh, wow.
That was loud.
All right, go ahead. Tilt.
Oh my God. Now I see why everybody has that reaction on YouTube.
All right. Go ahead and tilt. One second. He's off to the races.
I can't wait.
1 second. Left.
Oh, yeah.
Man,
That was
right
awesome.
side.
That was amazing.
Go ahead, tilt left. Yeah.
That's deep.
That was stuck. That
That was-
bottom one was.
I know, because I
Oh.
felt it forever.
Oh.
I'm sorry, I didn't mean to spit all over you, but
No, you're
yeah,
fine.
I
You're
felt
fine.
it forever though. Forever. I've always known there's something wrong.
Something's clogged in there.
Yeah.
Yeah. Let me show you the picture of your back here real quick.
Wow.
I mean, that's a lot.
Yeah. I didn't expect that much inflammation on the left side.
But like I said, this is the sciatica. Your sciatica is from mainly that guy right there
Really?
is what's
Wow.
causing your. I mean, there's some
I
on the
would have
right.
never
there's,
imagined.
There's some on the right, but
Yeah.
it's a lot darker.
That's crazy to me.
And then that's the spot. That's what you're pointing to.
Okay.
So my point is that we want to. There's definitely a blockage, and we're going to stretch a little bit. I'm going to try to adjust it again.
Okay.
You know, it's frozen. It needs a couple hours of care to unlock that area.
I believe it.
And then you can see in the neck there,
Yeah.
there's blockages on both sides of the upper neck. You mentioned earlier have you done anything similar to what you're laying on right now? Have they put you on a device that's arching you back like this?
No, not really.
Not really?
No.
Okay. The goal is 20 minutes. In order for a change to be enacted, we have to hold this for 20 minutes. The ligaments that define your posture, that wrap your spine, will not change in 2 minutes or 5 minutes or 10 minutes. They have to be held for about 20 minutes meaning when you come up, you're in a different place, that you're actually in a different posture. And that took till like the mid-90s to figure that out. So chiropractic started in 1895. They didn't figure out till the mid-1990s that you have to stretch to change posture. Chiropractors still we're teaching that adjustments change posture. That me adjusting you is gonna bring your head back. Does that make sense?
Mm-hmm.
And I'm here to tell you that's not true. You can't change posture through adjustments, but adjustments are necessary to make the spine supple and willing to accept stretching. Makes sense? So they have to go together, but it isn't, other than perhaps for 30 seconds or 20 seconds, posture might change through an adjustment, but you're not changing the ligament length, the ligament laxity, the tightness of the rubber bands. The ligaments on the front are all tight. You have to stretch out the front, compress the back. Get the idea?
Yeah.
And ultimately, the idea would then be to put this strap on your forehead and pull. Get it? You then pull the neck in. Don't necessarily want to do that the first time we do it, but
Does he need a block or anything?
how's your neck doing? You okay?
Yeah.
If anything starts going tingly down your arms, we can put a block behind your neck to reduce the depth a little bit. But
You said this. How would this feel?
well, the idea of this strap is that it actually goes on your forehead.
I'd be okay with that.
It pulls.
I really would.
I have not seen many people who even want to do this. That's fun.
Oh yeah, that's awesome. I love that.
You just want to be this device is meant to be used under chiropractic supervision. So there are other nerdy chiropractors like me that call it chiropractic biophysics, idealspine.com. I'd be happy to let you lay on the the yellow guy without as much care, but when you're doing the bungee strap, you just got to make sure the whole spine's working as a team. And it's meant to be used with neck adjustments.
Yeah.
That's good. Wait. Leg straight for this one if you can. There you go. The idea is to have it in the middle upper neck, so it will have a tendency to want to slide down to your lower neck where it's looser. We want to try to be as vigilant as possible about keeping it in the upper neck. You'll take your hand, place it on your forehead, you'll press, get your head to sink into it, and then you put your hand back down to the side or wherever you want to put it. And then 20 minutes, same principle. Keep these arms crossed best you can. There we go. Take a deep breath in. Exhale. Yeah, one more. That was a deep one.
Yeah.
Let it go. All I got, bud. There's neck one more shot. See if there's any more. There you go.
That's awesome.
You're breathing.
I'm going to take a nap. Come up for see how that feels. Yeah. See how that feels. Let me see. How's that doing?
It feels good.
A little looser?
Yeah.
Yeah. Yeah, it's master of time. You gotta get on those stretches.
Yeah.
Work on keeping that head back. As much as possible throughout our life, try to avoid, that
Text neck.
forward neck and the text neck. The anchors of the neck are right down there also.
Mm-hmm.
So as the head goes forward, this all pops up. So as much as possible, keeping that chin, not tucking it to your chest is a part of your care.
Okay. Thank you.
Pleasure, my friend. Yes, sir. Thank
I
you.
appreciate it.
You did great.
Thank you.